India is paying very, very close attention to what happens in the United States of America. There is a battling and perhaps close to its peak, maybe just a couple of weeks away, some say, when it comes to the coronavirus battle. America is virtually a battlefield, and like everywhere else, doctors and healthcare providers are at the front line of that war. On the program today, as an Indian, it is my pleasure to introduce an extraordinary Indian-American family. 3 doctors, 2 brothers, and the partner of one of the brothers, and we believe even the partner of the other brother is a doctor. That's 4 doctors in one family, the amazing Purohit family that is doing extraordinary work at the front line of this battle against the coronavirus. Dr. Raj Purohit is in New York. Dr. Surinder Purohit works in Michigan. And we also have Mamta Purohit, Raj's partner and wife, also a doctor, joining us from New York. And this is really an extraordinary moment. And I do think people need to feel better about life right now. And I'm looking at the 3 of you, and I'm really feeling better. And I want to start with you, Raj. I mean, is this just coincidence that 2 brothers and the 2 wives are all doctors? Like, how did that happen? Or did you plan it like a good Desi family? Like, you know.
Well, I wish I could say it was a coincidence. I think we were inculcated with values of service to the country and to people around us. By my father, who happens to also be a doctor. He grew up in a very impoverished circumstances in a small village in Rajasthan called Ganadi, and sort of worked his way out of the village, but always gave back. And I think growing up, we came from this fairly humble background from the village in Rajasthan. But at the end of the day, he taught us the importance of serving others. And what better field in some ways than medicine to be able to serve others.
It's extraordinary. And Mamta, I know that, we have common friends, and they told me that you actually studied in a Hindi medium school growing up. And this is really an extraordinary, in a sense, journey for all of you and for your father. Tell us a little bit, before I come to the grave and the grim conversation about what's happening with the virus, tell us a little bit, Mamta, about how you grew up, where you grew up, and what life was like in school. And I don't mind asking you that in Hindi as well for our viewers who only understand Hindi. आपकी जो बचपन थे, आपकी जो याददाश्त है, उसके बारे में कुछ बताइए।
मैं राजस्थान में ही पली बड़ी। मैं राजस्थान के सारे छोटे-छोटे शहरों और में रही हूँ, लगभग पूरे राजस्थान में रही हूँ। पापा का जॉब ट्रांसफरेबल था, वो डिस्ट्रिक्ट जज की तरह से पोस्टेड थे, तो हर 2 साल में एक दूसरे शहर उनका तबादला हो जाता था। तो अल्टीमेटली जयपुर में सेटल हुए। वहीं के मेडिकल स्कूल से मैंने अपनी मेडिकल ट्रेनिंग करी। पहली ट्रेनिंग मैंने अपनी बीकानेर में रेजिडेंसी करी OBGYN में, और वहां से मुझे बहुत सीखने को मिला। उसके बाद में मैं US आ गई in 2001, and since then I am here.
It's really it's an uplifting. It really is an uplifting story. And Dr. Surinder, if you want to add to that. They say that you can take a Desi out of India, but you can't take the Desiness out of any Indian, no matter where he or she goes. And I know that a lot of Indians are feeling enormous pride looking at all of you right now. And I'm sure your father, given his deep roots in India, kept all of you very rooted in our country as well, Surinder.
Yes. It alludes a little bit to what Raja was saying. My father came from a small village in India, and even though he left Rajasthan many years ago, Rajasthan never left him. And that love of Rajasthan and India and that love of service to others, I think that was what was inculcated in my brother and I. And I think one of the ways our father has been such an influential person for us is he influenced not just my brother and I, but many people from the small village he came from. It's remarkable. This little village in Rajasthan has managed to produce so many people who ended up becoming influential in Rajasthan and throughout India, IIT graduates and doctors and engineers and businessmen. And it all started with just my father and a couple of other people many decades ago. And they sowed the seeds. And I think we're starting to witness we're reaping the benefits of all of those things now.
Wonderful. And I will ask you later about your memories from growing up in that village in Rajasthan. But I want to talk about the battle that you're all, soldiers in right now. And I'll start with you, Raj, if I may. You're in in one of the hospitals in New York, Mount Sinai, where this war is unfolding. And we're watching halfway across the world really, really terrible sort of stories coming out of there. What is it like right now? Because, and I ask from the point of view of what we sitting here in Delhi, in India, can learn.
Well, it's terrible. We just passed a grim milestone, which is that more people have now died of COVID in New York than those died from 9/11. And you can imagine how much resources the United States mobilized in 9/11. And unfortunately for COVID, this is just the beginning. We're beginning to continue to increase the numbers every day exponentially. The numbers are increasing, whereas 9/11 was a discrete event and didn't happen again, thank God. Here, we're going to be seeing 9/11 every week, those kinds of numbers in New York. The city itself has been transformed. My hospital has been transformed. What used to be the cafeteria is now an ICU. What used to be Central Park, where I used to go running every day, has been converted into tents for triaging patients to transfer them into, to decide who needs more urgent care. What were normally patient floors with regular non-urgent patients have all been converted. The hospital is full of COVID patients. Our ICUs are full. I think the doctors at Sinai have done an extraordinary job of managing these patients, though. But it's a transformation unlike anything I've ever seen in the city, and unlike anything I've seen in my hospital. And this transformation has occurred at every level. They've used resources that we hadn't thought about. They're recruiting urologists, dermatologists, neurosurgeons to start working in the ICU and the emergency room, and really transform not just the hospital, but the relationships amongst each other.
Yeah. Raj, I'm just struck by that one sentence that you had in there. You said there will be a 9/11 every week. And I have to ask you, how many more weeks of that?
I wish I could tell you. I mean, the key thing is how many people infect other people. And right now, the numbers as they're going, we're sort of estimating peak numbers to hit in the next week or two. But that's going to be if people follow instructions about isolation and really follow, the standard guidelines that everyone's been hearing about. Unfortunately, not everyone does that. But I'm praying that this could last another few weeks. If we're unfortunate, this could last a few months. So imagine, a plane crashing to the World Trade Center every week for months. This will be terrible. But I'm praying that this will be better in the next 3 or 4 weeks.
It's chilling to even hear that, but it's also, gives me pause to think that the 3 people I'm talking to right now, you're all virtually risking your lives every single day. And I know that it means changes in your own personal lives as well. Mamta, I believe that you and Raj actually make it a point as partners to not be in the same physical space. You're careful of not infecting potentially each other. Can you talk a little bit about the personal toll that this has taken and what goes through your mind every day when you're seeing your patients, knowing that doctors and hospitals are the most vulnerable and have often been the epicenters, as it were, of the virus contagion?
Yeah,
let me get Mamta in on that. Mamta,
That's right. The doctors are really facing it at the front line. And we are seeing many doctors getting sick and they are facing difficult time at home too. This morning, I just came to know one of my colleagues lost both of his parents, which is very sad. And recently, within 24 hours, he lost one resident doctor also, a junior doctor. Mm-hmm. So these are heartbreaking things, but it's our reality. We are all getting exposed to corona. And we are all at risk of bringing this infection home. And with this infection, you can be completely asymptomatic for 5 days. So essentially, you cannot really talk to or communicate with anybody at home because you don't want your whole family to get infected. Mm-hmm. Some of my nurses or other doctors have chosen not to go home. They're staying in hotels because they don't want to infect their family. Because remember, New York apartments are not very big. We are lucky enough to have a bigger space in our home, and currently I have moved on to my daughter's bedroom and I'm using her bathroom, and Raj is in our room, so we are in totally different floors, not interacting with each other, not eating with each other. We are trying to maintain social distancing even at home. So it is hard.
And Surinder, what do you tell yourself every day when you go in to save lives? You're like soldiers. This is modern warfare and you're our soldiers. What do you tell yourself? How do you keep yourself calm? How do you keep yourself clear-headed?
Well, I think as Mamta and Raja have explained really well, there's tremendous amount of angst and anxiety in physicians, healthcare providers. Obviously, in our situation, both of our spouses are also doctors. And, we have, on the one hand, the obligation, we're trained as physicians to, at our own personal risk, to help others. But the one thing that never occurred to many physicians in the past is we now face a situation where there's not only personal risk, but risk to others, our family members and our spouses, our children. And so, we try to do what we can and to reduce the risk of passing something on to our children. You sense that anxiety in our kids. We try not to focus too much on discussions related to the virus at home. However, kids are smart. They watch the news and I know especially my younger son and Raja's younger son, they get concerned, and it's natural. I know my son calls me frequently at home, Dad, when are you coming home? And so these are things that are there, and it's, we try to do our obligation to our society best that we can.
Yeah, it's extraordinary what all of you are doing. I want to talk a little bit about the science as much as we know it, the medicine as much as we know it thus far. I'll start with you, Raj. One of the debates in India, and it's almost mirrored the debate in the US, is how much testing is enough testing. And the WHO, the World Health Organization, keeps saying test, test, test. But we're a country that spends less than 2% of its GDP on health. The Americans spend, close to 20%. And even then, in the United States, most people believe that not enough testing is happening. Is that something you agree with? How critical is it to test, and on a massive scale?
I think testing is absolutely the key. And part of the problem is that asymptomatic carriers can spread the disease to other people. And there's no way to know whether you're an asymptomatic carrier or not without testing. Unfortunately, testing does cost a lot of money, but this is where technology and industry can play a role of driving down these costs of testing as we get more and more sophisticated technologies. I think it's possible to provide testing more cheaply and more quickly. But without testing, to me, it's almost impossible to control this disease, because you'll have asymptomatic carriers who feel perfectly fine, who then infect someone else and cause them to get sick. And that someone else might be their grandmother, it might be their colleague, it might be anyone else. But without testing, it's impossible to control this disease. And unfortunately, in the United States at least, we haven't had those resources available to do mass testing in a way that other countries such as Singapore or Korea have been able to do.
Yeah. So let me get Surinder and Mamta to join that. If you feel the United States doesn't have the resources, think of what we're going through here in India. Surinder, South Korea had rapid diagnostic kits. We don't have those. We're still relying on the PCR test. And there's that. And then there's this whole debate over whether you actually need to test for antibodies to see the scale of the spread, to see exactly how many people are infected. But antibodies, and I'm saying this as a layperson, I believe take a week to develop. So that again competes with timelines. So what should we be learning? What should we in India be learning from what all of you are going through there, Surinder, and then Mamta? Surinder, you go first.
Yeah, I think those are all very good points. First, and you mentioned South Korea. One really staggering fact is the first case of COVID-19 in the United States was diagnosed very close to when the first case in South Korea was diagnosed. And yet, South Korea, the situation is under reasonable control, and it's out of control in the United States. Just to give you an example of how out of control it is in my community here in Michigan, 3 weeks ago, first case of COVID-19 was diagnosed in Michigan. And 3 weeks later, we now have 10,000 cases. Just in the last 24 hours, 2,000 new cases have been diagnosed. And it's just staggering. And the difference is in South Korea, they started off, they had experience with previous viral pandemics, so they tested everybody. And they were able to isolate people who tested positive. They were traced down the contacts and separate those people. And this is something we didn't do. The other thing, unfortunately, we have had mixed messaging from our government. There's been messaging that's been one message coming from the federal level, Washington, and a different level coming at the state level. For example, here in Michigan with our Governor Gretchen Whitmer, there's political considerations that have been going on, and it's caused the message to be completely muddled. And a classic example of even now how everybody's not on the same page. So yesterday, the CDC recommended that all Americans wear masks when they're out. And the reason to do that is more to prevent the asymptomatic carriers from spreading the disease. But at the same time, the CDC is saying this. Our president is saying he leaves it up to people to decide, and he himself is not going to personally wear it. Whereas our governor here in Michigan says, I'm going to wear it, and everybody should wear it. So this kind of mixed messaging is confusing people, and that is something that I think India can learn from, is to make sure the federal, the state, the local, everybody's on the same page, to get that message out, to protect people, put your political differences aside. This is something that is an existential threat to many people's lives, and it's really important that the message we hear is coming out loud and clear, and it's uniform, it's consistent, and it's science-based.
That's such an important thing you've said, because we're seeing some of that mixed messaging and that lack of coordination between our federal governments and our state governments here in India as well. Mamta, please add to this point about masks. And I ask you this because when I first started reporting this story in India, I would go out without wearing a mask. And my understanding at that time was that I should leave the masks for healthcare workers who really need it. And I was gobbling up an already short supply of masks. Since then, the advice seems to have changed. As Surendra mentioned, it's also, if you're asymptomatic, you're a vector, you shouldn't be transmitting. That's one reason to wear a mask. The second is this rather alarming study that we've seen that we don't fully understand about whether this virus can be airborne. And there's a lot of confusion, a lot of incomplete information on this. So I'm just wondering how all of you as doctors are treating this on the ground.
So this is a novel coronavirus, means it's a new virus. We are learning as we go. Unfortunately, we did not get enough data from China, or the data that we got is not completely transcribed into our situation. So it is a problem. So the reason they are advising mask, because mostly it's a droplet precaution. So if somebody is coughing and sneezing and throwing any droplets on you, your face, nose, and eyes, you can get that infection. So not only the mask, but you should also be using an eye protection or a sheet, like maybe plain glasses the general public can wear in a case if you cannot find any sheet. So, and if you do not have any mask, we are advising people to cough and sneeze in their elbows instead of using their hands, because then they get virus on their hands, they touch all of the surfaces, and virus can stay on the surfaces for a long time, like for example on cardboard for up to 24 hours and on the metal surfaces for 2 to 3 days. So anybody else touching those surfaces and touching their face can take the virus to themselves. So that's why it's also very important when they're wearing a mask, probably they are not really contaminating all of the surfaces around them. But for healthcare providers, we need a special mask. We need N95 mask because this virus can be in the air, but generally the higher chances of this virus being in the air are when we try to intubate somebody or give them high flow oxygen by nasal cannula or BiPAP or CPAP. Those are the medical procedures. But as the new evidence is coming up, I will not be surprised if they will change the guidelines and say everybody should be wearing a N95 mask. So I will not be surprised.
Yeah, that's the point. It's so confusing. And Raj, as the science changes every day, the biggest crisis in India, at least today, and I'm sure you've seen some of that in the US as well, is the shortage of PPE, personal protective equipment. The big hospitals in India have enough of it, but the smaller towns, the smaller hospitals, maybe the kind of place that all of you came from in Rajasthan, doctors are heroic, health workers are heroic, but there are not enough masks, there are not enough hazmat suits, there are not enough goggles, there are not enough gloves. How is that situation there? And, a doctor told me the other day that we're using Indian jugaad. Doctors here, in some cases, are using polythene bags, they're using raincoats, they're using towels. It's sad to see, but they're being heroic soldiers in the battlefield. So Raj, what is the situation with the PPE in the US and for all of you? Like, do you have enough equipment to keep you safe, to make you feel safe, Raj?
We've been fortunate that we've been able to get enough equipment within our department. Unfortunately, as this disease is exponentially growing, I think this will become a real problem for us. And we're trying to figure out new ways of potentially re-sterilizing old masks and reusing some of the PPE in a way that makes sense and that's safe for all of us. I wish I could give you good news. I wish I could say that there's plenty to go around for everyone, but as this disease sort of invades the rest of India, or the rest of the United States rather, I think it's going to be a problem everywhere. And the other problem is that as more and more people are using their own masks, because of the new CDC recommendations, I think there'll be a run on masks and on PPE that's going to make it even more difficult for healthcare providers, those at the front lines of this war, to be able to get adequate PPE. So this is the kind of thing where the government can really play a role and try to rejigger industry to start producing masks, start finding masks from other resources, and allow us all, not just the healthcare workers, but allow the population at large to have adequate protection as well.
Well, I'll share something with you. The manufacturers in India actually wanted the government to issue an order that the general public should be banned from buying N95 masks, because what we saw was this flood of random people who are never going to be at the front line going and hoarding N95 masks. So this confusion is literally happening everywhere. Now, here's to the important question. Do lockdowns work? And different countries have approached lockdowns differently. The US has had a kind of staggered, you don't have a national lockdown. We presently in India have a national lockdown. Surinder, what does a lockdown do? Is it a good idea? We don't even have public transport right now. We're also a much poorer country. We have 45 million migrant workers, and we also saw the images of them. I walked with some of them, walking hundreds of kilometers on the road. There are people here who are scared that poverty will kill them before the virus will. So I think it's very important for our viewers to understand, what does a lockdown do? I'll start with Surinder, and then I want to take that around the panels.
Well, first of all, India is a far more complicated place than the United States, and with less resources than the United States. And you're absolutely correct. There are a unique set of problems that come with a lockdown, with a migrant situation being a prominent example. One of the key things, as we've been talking about, is, and you've been inquiring, is do we have enough resources? Do we have enough ventilators to handle all of these? And even here in the United States, what we're trying to do, the purpose of the lockdown is to try to, to flatten the curve, like you've heard in the news, so we don't have a surge of all these people coming in critical condition requiring ventilators. And no matter how innovative you get with ventilators, whether you try to use one ventilator on 2 or 4 people, at the end of the day, there will not be enough if there's a massive surge of people. And I think that is one of the key things with the lockdown and social isolation, is to try to flatten that curve so the number of patients who are treated spread out over time. And I would think that this would apply to India also. But again, the situation there is very complicated with the migrants, the rural hospitals, urban government hospitals, more limited resources. And so, I wish I had a clear answer there. I'm not sure anybody does right now.
Yeah. Mamta, add to that. The point is, from what I understand from speaking to friends in the US, public transport is open. You can go out for a walk. Groceries are open. Groceries are open here as well, and you can go out for a walk. But we see people now, some people are too scared to go out for a walk. So let me ask you questions that I know a lot of Indians would want the answer to. Is it okay for them to go out for a walk? Is it okay for them to take their pet for a walk? Is it okay for them? What should they be absolutely not doing? And what is it okay to do? Based on what we know so far. Nanda.
People should be staying at home, should not be going out unless it's an emergency and they cannot avoid it. The lockdown has 2 goals and principles. I think currently lockdown is the only weapon India got. Mm-hmm. Because the lockdown, for India, it's a stage of containment. If they can lock down, they can trace all of the contacts, they can isolate them, they can stop the spread of this disease, and they may come out like a South Korea with a minimum mortality. For us, we are way beyond the period of containment. Now we are in the situation of damage control. So we are trying to implement lockdown so that people are maintaining social distance, and the surge of patients that we are seeing currently in the hospital, we can minimize that surge so we can keep the number of the patients under the number that our hospitals can deal with. So we can reduce our mortality rate. We are way beyond the limits where we can control and eliminate this disease. So we have to go through this surge. But in India, there is still a hope. if all of the India state follow lockdown and all of the patients can be traced and isolated, that's the best way to go.
Well, fingers crossed on that. But Raj, you have President Trump making the argument that the cure might be worse than the disease. He made noises about wanting to lift the lockdown. The state governors were absolutely against it. And so that hasn't happened. But you also had a kind of Boris Johnson approach initially. And of course, ironically, he's tested positive since then himself, to create herd immunity in the population and saying, okay, most people can get infected and get better. So let's just focus on the elderly, and lockdowns don't work. That was the UK's first instinct, and they had to backpedal from that. So Raj, come in on that. Is there any merit to those who are saying the cure is worse than the disease, like Trump is?
Both Boris Johnson and Trump are not scientists, and I wish they would stop speaking on behalf of scientists and doctors who are actually on the front lines. You can revive the economy. That's a year from now, 2 years from now, I think the economy will have recovered, at least in part. You cannot revive dead people. Once someone is dead, you can't bring him back to life. And right now, our number one goal should be to make sure more people don't die. I think this is not an economic equation. This is an ethical equation. This is a moral imperative for all of us, that we have to frame this issue in the right manner. There will be massive economic consequences, but what is a human life worth? What is 3,000 lives worth? What's happened in New York, or what is 10,000 lives or 1 million lives worth? I think none of us would put a price tag on our parents' lives, our children's lives, and I don't think the government should really do that too. There will be massive changes, but we have to accept that. We have to accept that economic damage in exchange for the fact that we live in a moral country, an ethical country, where human life is important.
That's very powerfully said. You can revive the economy, but you can't revive dead people. But I want to focus on the elderly. We're all desis here, so you know how much this matters to us. We don't come from a culture where our older people are in old age homes. Mostly they live with us or they live close by to us. Surinder, what should we be doing? Because we know that older people are the most vulnerable. If they're older and diabetic, they're even more vulnerable. And there's this sense of wanting to meet your parents at this point. Is the biggest favor you can do to them to not meet them if they're of a certain age group?
Absolutely. Absolutely. I'll tell you, for me personally, my parents live about half an hour from where we live. And my wife's parents live about half an hour from where we live in Michigan. And I have given both of them strict orders that they don't leave the house unless it's truly an emergency. And they miss their grandchildren tremendously, but we cannot go and see them at all. Luckily, we have FaceTime now and other ways of getting a hold of them. But the best thing we can do for patients, older patients like our grandparents, our parents, and people who are sick, immunocompromised, have other health conditions, is to stay away from them and to have them stay away from other people. That is really, really critical, because right now, if somebody in their age group gets sick from this virus, we don't have any cures for this. We have, as you know, supportive measures, but there's no cures. And so the best solution is to not get the problem. And that's what I advise older patients.
Mamta, the science suggested that it was older people who were the most vulnerable, but we are seeing disturbing new reports of younger people, especially children, now developing a severe reaction. I'm just wondering what all of you are seeing on the floor, in the battlefield. What's happening with very young people, Mamta?
So actually, this disease affects all ages. So it's more likely to kill elderly, but it doesn't mean it's not killing young people. Like at least 2 patients that we lost yesterday were 27 years old. So and I don't think they had any comorbidities that we were aware of. I'm seeing people 38 years old, 41, 51, all ages are involved. There have been a couple of incidences where a newborn baby or a 17-year-old kid in our area has passed away. But generally, kids less than 20 years of age, they tolerate or deal with this virus in a better situation than anybody older than that. And the more comorbidities you have, your risk of dying or having serious complications is very high. So it's a problem for all. It's a problem for all. I will like I will really recommend all Indian people to stay inside. Do not think that you are young, you are healthy, you can go out or you can do anything. Even if you become an asymptomatic carrier, you will be bringing this disease back to home to one of your family members who may not be as healthy or as strong like you. So ultimately, you will be bringing this death of your own family member in your own home. So please stay away from everybody and maintain social distance.
Yeah.
Barkha, one thing.
Yeah. You wanted to add there? Go ahead. Yeah.
One thing I would just briefly add to what Mamta just said is a shocking figure here in Michigan. 40% of patients who have tested positive for COVID-19 are between the ages of 20 and 48.
Wow.
Okay, 40%. And 11% of those who have died are less than the age of 50. And so this is, it does affect older people more, but younger people are not immune for this, and they need to take this extremely seriously.
Yeah. I want to ask all of you, health is very political, for the US more so. You're in an election year. And, it's not because I'm concerned with the politics, but I'm just wondering whether the politics is disrupting the efforts that should happen, because that happens too, right? And that would be almost criminal. Raj, if you want to come in on that, because, we all watch Trump's press conferences and they used to be very entertaining, but you can't use the word entertaining when it's about life and death.
Well, I mean, unfortunately, in my opinion, the press conferences are more tragic than entertaining now. He was in a position to lead from the beginning, and they've always been behind. The politics, this is obviously in the United States an election year, and Trump, as Surendra can probably attest to, has been having a political fight with the governor of Michigan. The governor of New York, Andrew Cuomo's, had a little bit of a better relationship than Trump, but I think these kind of calculations that he's making about what's going to benefit him politically, and the fact that he's putting things like his family members in charge, put his son-in-law, Jared Kushner, in charge of the COVID response, is completely outrageous. Someone who has absolutely no knowledge or ability to manage this. But in addition to that, there's some potentially positive political findings, political changes. The United States has never had a national healthcare system, and it's something that we've suffered from. And in some ways, the problems with COVID now are stemming in part from the inequities of the healthcare system in the U.S. And there are some changes, even in New York, for example. The governor is potentially been providing centralized care to hospitals, whether or not patients have insurance. So some of these changes that are political about how we provide health insurance, how patients get access to care, may last even after COVID. And these are potentially positive changes. And I think in some ways, what's political about healthcare is how we interact with each other, and it's changing how we interact with each other. And if my poor neighbor gets sick, it might infect me and my family. And I think people are recognizing that. And, because he doesn't have health insurance doesn't mean that he shouldn't get care. It's just on a selfish basis, because my family might get sick as well.
Sure.
So these changes are happening, and I think there will be long-lasting changes, political changes in how we think about healthcare.
The only kind of silver lining in these dark clouds. Let me ask all of you quickly as we approach the end of this conversation, the one piece of advice you'd give India. I'm sure you've been following what's happening here. It's not clear to us whether the lockdown will be extended beyond the 21 days. It's not clear to us whether the containment has been successful. If there has been community transmission, we do not know the scale of it yet. I just want to also remind our viewers that 95 million Indian households live in one-room structures. So sometimes staying at home actually gets to be complicated. It has a different meaning here. So just one piece of advice that all of you think we could learn from you. I'll start with you, Surendra.
Well, I think the most obvious solutions, what we talk, first step is, especially in the stage where India is to really be strict about the social isolation. And you're right. In urban areas, in areas where people are very congested, it's very hard to be separated. But as much as possible, social isolation, wearing masks, whether it's a handkerchief around your face, to reduce the risk of the asymptomatic carriers passing on this disease to others.
Yeah. Mamta?
What I would like to say besides social isolation is watch each other's back. See if your neighbor really needs something. If you're stepping out and getting groceries for yourself, buy it for them. If there is an elderly in your neighborhood, see in a case if they need something, you can go and leave it on their doors. And second thing, as an OB/GYN or obstetrician, I'm noticing more and more cases of domestic violence. People are cramped in the same houses, and And the people who didn't get along together, they are having these problems. Just this morning, I saw a patient who was beaten down, 8 months pregnant, and came with bleeding. And it took me at least an hour to stabilize her. So keep an eye out for your neighbors. See in a case if they need any help. In a case if they cannot speak up, maybe you can reach authorities and you can find a safe place for them. So it looks like it's a whole community that has to come together because it's a communicable disease, and only in that way we can control it and we can win over it.
That's such an important point about what's happening in some marriages. The National Commission for Women in India records an increase in the cases of domestic violence. So I'm glad, Mamta, that you flagged that. Raj, let me get you in. The one piece of advice, the one fatal mistake that India should not make.
Well, I would echo both what Mamta and Surinder have said. Remember, social isolation is the cheapest thing you can do in some ways. It doesn't require buying protective equipment. It doesn't require anything. And it doesn't require a lot. So right now, one infected person can cause about 2.4 other infections. Social isolation doesn't have to be perfect. Well, all you have to do is if you decrease that number of transmission to less than 1 by having some social isolation, the disease goes away just as quickly as it showed up. So there's exponential growth because of the 2.4, but there's also exponential decline. And if we can sort of enact this social isolation policy, as best as we can, I think the disease could really be much, much, much less of a burden. But it's going to be tough, and these are the issues you brought up.
Yeah. Briefly, I want to end with something that is emotional and sentimental. The memories that you all carry with you, your father's memories, your own memories from India, from Rajasthan. ममता आपसे शुरू करूंगी. एक याददाश्त जो आप भूल नहीं सकते.
इंडिया में मैंने अपनी रेजिडेंसी बीकानेर में करी और वो बहुत ही हाई वॉल्यूम रेजिडेंसी थी कंपेयर टू यूएस में इतने ज्यादा मरीज नहीं आते. वहां पे एक शिफ्ट में, एक 12 घंटे की शिफ्ट में हम 25 डिलीवरी कराते थे. So we really had to prioritize our patients. देखना पड़ता था कौन ज्यादा सीरियस है, किसको पहले देखना है, किसका पहले इलाज करना है, और गोल हमेशा ये था कि कैसे जान बचा सकते हैं अपने सारे मरीजों की. I have picked up some very serious cases that I had to literally drag them to the operation theater, do their surgery immediately, stabilize them, and that training is coming very handy to me now. Because now, when we are dealing with this pandemic, all of the hospitals are overwhelmed, performing at 200% of their capacity. I can prioritize, I can decide which patient needs my help first, how can I help them first, and then I can go back to my regular patients. I'm actually trying to strategize this work for all of my hospital workers also. I work as a simulationist, like I create a simulation situation where I use the robots and the dummies, and I train my staff workers for emergencies. So I try to make a strategy and simplify them, like bullet points 1, 2, 3, 4, so that if they handle any emergency, they know exactly what to do. Yeah. I was involved with the Ebola training here in US, and then teams from Nebraska and Houston came to train in New York. At that time, I was involved with their training, and now I'm utilizing all of my knowledge, whatever I learned from my teachers and doctors in India, to strategizing everything for my work. I know Indian doctors are great. They are fighters, and they can prioritize, and they can make the best out of it. So I have full trust in Indian doctors.
I was just going to say that Indian doctors are the best, but also India toughens you up. In a way, India toughens you up like no other country. And so I think that's why all of you, apart from being brilliant, are also probably tougher than, what a lot of other communities may be. Surinder, the memory that you take from here, that you can't forget, or the learning.
Well, when I look back, I spent the first few years of my life in India. And one of the things that really ingrained in me about Indian culture is how familial it is, and I don't mean just family directly, but anywhere you go, whether it's a stranger you've never met before, or it's rich person or poor person or homeless person on the train, how they take you in and treat you as somebody they have an obligation to. And that kind of thinking, I think, is absolutely critical right now. In the past few years, we've just had this notion that we're United States, America first, everything is us, and everybody wants to do their own thing. And you have a crisis like this, you have a pandemic that really flattens everything, and it highlights that this is a virus that's going to affect a pauper or prince or prime minister or president or whoever, and it can affect anybody. And, you know, it harkens back to that ancient Sanskrit saying, Vasudeva Kumbhakam, meaning we're ultimately all one family and we're linked. And I think if we have that approach, try to help each other out on our community level, on a family level, on a national and global level, we can get over this unbelievable crisis that we face.
Raj, I'll give you the last word.
Well, me and my brother are about 5 years apart, and I was thinking about this last night before I went to bed.
Which one of you is older? Which one of you is older?
I'm surprised you can't tell.
I just wanted to create some trouble. Some nice, gentle distraction. Yeah.
I was thinking about how the world comes back around. You know, we actually had another brother between us in ages. And when we were children, he passed away from tetanus in MG Hospital in Jodhpur. And he passed away because he didn't get the vaccine for tetanus and because they didn't have enough ventilators for tetanus. And here we are almost 40 years later, 45 years later, after having gone through all of these elite academic institutions in America, practicing at elite places like at Sinai or in Michigan. And we're back where we started in some ways. You know, we're still looking for ventilators. We're still looking for that vaccine. And when I see patients, who are asking me whether they'll have enough ventilators, it's tough not to think back about India, think back about the journey we've been through, that a lot of Indians have been through from over the last 50 years, and the kind of technological progress that's happened. I wish there was better news in some ways, and that we now have the vaccines, have the ventilators. But it's funny how the life comes back around in full circle.
That is truly poignant. Life does kind of take you back where you started in some ways. I can only say that all three of you have said, I wish there was better news. I think the better news is that there are people like the three of you. And Surinder, we wish we had your wife on the show as well, but next time. This extraordinary family, the Purohit family, originally from Rajasthan, at the front line of that battle against the coronavirus, the COVID-19 in the United States of America, making Indians and the Indian American community proud. We want you to stay safe. Please stay safe. Please look after yourselves, and we'll be in touch. Thank you so much, Dr. Mamta, Dr. Raj, and Dr. Surinder Purohit. Pleasure having you on the program.
Thank you very much.
Thank you.